introduce my experiment project Predicting Influenza Infection by Clinical Features-Based Machine Learning Algorithms. According to the statistics, the number of people hospitalized with influenza is as high as 10 million each year, and the death toll has reached hundreds of thousands. Furthermore, studies have also pointed out that influenza in low-income countries will cause higher mortality and a huge medical burden. However, influenza has not been effectively diagnosed and treated in primary care institutions. Many patients cannot be immediately confirmed whether they are influenza in clinical diagnosis. Clinical diagnosis of influenza infection is pretty challenging because it's unclear symptoms just like fever, cough, headache, and sore throat. These symptoms are usually similar to other respiratory infections diseases. Therefore, we hope to establish a reliable tool which can be timely used to help clinicians diagnose influenza in real time. Taiwan's Linkou, Taipei, and Keelung Chang'an Memorial Hospitals are cooperated with Pen's hospitals. They have collected the medical records that patients with influenza-like symptoms on the emergency room visits list between 2015 and 2018. There are 1,723 patients in total. After screening through accurate methods such as screening protocol PCR, travel history, past medical history, and contact history, it was confirmed that 633 patients in Taiwan and the United States were influenza patients. These collected medical records were used to create an instant system for predicting influenza, and it was introduced to Taiwan. So, the results of running these influenza-like illness medical records were like this figure. We use the ILI medical records that patients with symptoms like fever, cough, headache, and sore throat. And the system will screen the positive symptoms. These results is what we expected. For example, the positive symptoms mean this patient have sore throat or this patient with cough for 4 days, and fever with chill means this patient with fever, and this is the positive words. However, there are some wrong data showed in the positive results, just like this picture. Fever nil. Fever nil means no fever, but it still showed in the screening results. So I need to check every symptoms to prevent negative symptoms words showed out of the results again. At first, we classify these negative symptoms into 2 classes, just like this picture. One is no symptom words, and the other is other negative symptoms words. But after we modifying and running the algorithms again, we found other negative words showed in the screening results. So we added new symptoms marking rules to the dictionary. One of the classes is no symptom, just like no fever or no cough. And the number 2 is symptom nil. It means no symptoms, just like cough nil or headache nil. They are all negative words. It all means no symptoms. And the number 3 is without symptom, just like without notice fever or without cough. And other negative symptoms, just like symptoms with vague classification standards, were added to these dictionary classes. The last one is no symptom, but like no fever, but with some other not ILI symptoms. It means there are no ILI symptoms showed in the medical records. The above results are the types of negative symptoms words showed in the screening results that we have classified after many inspections. So, we have to continue classifying the new symptoms more detailed and try to verify the accuracy of this system for screening medical records repeatedly. In this way, the machine learning algorithm will be utilized to increase the pretest probability before approach to the patients in the primary care settings. Thanks for listening.